I remember getting rolled back and then waking up knowing that I would not have the ability to speak.
Waking up with a new tongue. Today, we learn how this firefighter spotted cancer early and what it took to learn to speak again. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. Firefighter Jason Spritzer had a cough that just simply didn't sound right, and he credits his captain for encouraging him to see a doctor, advice that may have just saved his life.
There's really no crisis KCMO firefighter Jason Spritzer isn't prepared for, but nothing quite prepared him for this.
I remember I had a cough after a fire, and that just wouldn't go away. I was brushing my teeth and I'd hit a sore in the back of my tongue. I had a really good captain that said that I ought to probably go see the doctor and get that cough checked out because it just didn't sound normal.
Jason, a father of 3, had no idea he was about to face the biggest challenge so far, an oral cancer diagnosis.
It was devastating in some sense because I had no idea what that meant, and I didn't know what the treatments were, and of course, I think one of the worst things you can do is go straight to Google.
Jason was referred to oncologist Dr. Kiran Kakarala with the University of Kansas Cancer Center. Concerned he may never talk normal again, they went over treatment options.
The treatment options were either going to be radiation with chemo or a partial flap replacement. And I'm like, what is that?
A partial flap replacement is a procedure where Dr. Kakarala basically rebuilt Jason's tongue using the skin from his forearm.
You can see right here that this patch has been removed. He had to cut all the way up into here so that I would have a viable blood supply. And so they removed this muscle with part of my vein to be able to go in and to be able to supply the blood to my tongue, what would be my new tongue.
A new tongue that now needs grooming.
I didn't know that I had hair on this site and for the flap replacement, and I thought I had hair in my mouth. So I'm going in and I'm feeling this hair, and it's not, it's because it's attached to the tongue. So simple, just tweeze it out.
Jason caught the cancer early and is doing well and speaking well. He's using his voice to help protect other firefighters from the same fate and toxins he believes contributed to the cancer.
It's a responsibility, and it's like, what am I going to do for the next person? So I leave it better, and I found it.
He's stepped away from his active duties on the scene and now works to make changes in procedures, policies, and equipment to minimize exposures.
I wanted to be able to take what I had, my experience, and be able to put it to good use.
And that's exactly what he's doing. We're so happy to have Jason in studio with us today alongside Dr. Kiran Kakarala. He is a head and neck surgical oncologist with a special interest in reconstruction surgery. We're going to hear how he rebuilt that other half of Jason's tongue here in just a moment. Great to have you both together. So Jason, take us back before the diagnosis. So you mentioned you had this cough. I would imagine you come back from fires with coughs often, right?
Typically, I mean, we'll fight a fire, and you know, it's strenuous activity, so it's nothing unusual for us to work really hard, and then, you know, no different than an athletic cough from you know, maybe, you know, having a dry throat or something of that nature. But this was different.
And your captain noticed it, and then you felt something and saw something when you were brushing your teeth?
That's right. So the next morning after my captain had mentioned that my cough didn't sound normal, and it had a little bit of a different sound to what he thought would be after a fire. And so the next day I had was getting ready to schedule a doctor's appointment, and I had brushed my teeth and I hit a sore in my tongue, and that, you know, obviously that's concerning.
Any clue, any thought that this may have been cancer?
None. Thought maybe it was a canker sore or something in that, like a lesion that you would get if you had too much acidic of a drink or something in that nature. And but I knew that I needed to go see the doctor anyway, so I committed to, you know, following up and following through with what my captain had asked me to do. And
you shared some photos. I want to show those and kind of walk us through what you're seeing. Could you see it? When you looked after you saw it with the felt it with the toothbrush, you could see this is the spot on your tongue that you hadn't noticed before.
That's a progression after the fact. The original sore was a white and very finite, and as you know, 30 days progressed, you know, it was growing, and But when that original sore happened, I thought it was just a little white sore. I had no clue.
Dr. Coccarella, what was the diagnosis? What stage was it in?
So looking at that picture, we were worried that this was going to be a more advanced stage. We staged tongue cancer based on how big it is and how deep it's in the tongue, and looking at that, that looked pretty scary.
Was it officially considered an oral cancer? Are there different types? Tell us exactly what that was.
It seems like we talk about head and neck cancer when we think of it as one thing, but it's actually all these little parts of your body. We try to divide them up. So the oral cancers include the tongue and gums and other parts of your mouth, so the front of the mouth, and this was considered an oral cancer, a tongue cancer.
A scary place to have cancer?
Yes, and actually, as we were talking about, most people don't think about it. Head and neck cancer doesn't have a lot of awareness, I think, in the public eye, so you just don't think a sore on your tongue could be cancer.
That's why you're both sitting here today. Bring more awareness to it. So what are some of the first symptoms? Is what Jason described pretty typical? What else could we be looking for?
Yeah, so cough is actually fairly unusual for a tongue cancer, but may have been kind of a sign, or maybe just good luck that you had the cough that your captain told you to get checked out. But usually pain on the tongue or bleeding on the tongue when you brush your teeth or your gums, those are two of the main signs.
Well, and usually when we get a sore, like on our tongue or canker sore or something like that, it's there, it's bothersome, but it goes away.
Right.
So if it continues to stick around, get it checked out.
Exactly.
So let's talk treatment options. Chemo and radiation weren't necessary, is that correct?
For a cancer like this on the front of the tongue, surgery is usually the best treatment, and chemo and radiation we really save for if they're absolutely necessary after a surgery.
So you get the biopsy the day before Thanksgiving. This all happened within a 4-week period. Day before Thanksgiving.
Day before Thanksgiving.
Take us through the next 4 weeks.
Got the results fairly quick. Called into the KU Cancer Center. I was put together with the nurse Navigator calling me back right away, and she was amazing. Her name was Rhonda. Rhonda calmed me down, and she assured me that she would help me navigate this process.
When you said calm you down, you were really highly emotional and had a lot of questions, I would imagine.
I mean, you're trained for crisis for other people as a firefighter, right? But then when you become the patient, we're probably the worst patients around, because we have medical knowledge that takes us into a different thought process. And as I was going through all the scenarios in my head, she kept me on point that I needed to go see Dr. Coccarella, and I used my health app that we have through MyChart. And she scheduled all of my appointments, and they were already in my MyChart app, which was amazing. All my communication, I could do all my follow-ups on that MyChart app. It was just really great.
So she was doing all the thinking for you in a
Everything.
time where you aren't thinking at all. So you get rolled back into surgery, and we're going to hear exactly how that surgery worked on Christmas Eve. Is that correct?
It is. There just happened to be an open slot for Dr. Coccarella for Christmas Eve, and I remember my wife and I were sitting in the room, and he brings it to us with an amazing bedside manner, and delivers the news of what the options are, and then delivers the good news that we can move forward fairly quick. I just didn't know it was going to be as quick because the schedule is, there's a lot of pre-planning that goes into this. It's not just Dr. Coccarella, it's a whole team. And the whole team was absolutely just amazing to me, and I felt very, very supported, and I know my family did as well.
So he comes in Christmas morning and tells you what?
That he's removed everything. They believe they got to the margins of what they believe were the margins to where the cancer was located. They sent things to the lab, and they were preliminary showed that it was really good. And then, came back not only on Christmas Day, came back the day after Christmas, was active with me through that whole process. I was there. I was here for a week in the hospital, and in the ICU unit, and it was great. It was just like, I can't even explain just the encouragement that I received was unbelievable.
Dr. Cacarala, so talk us through this flap procedure. We've heard of a skin graft, and when you see the pictures, you'll see why it kind of seems like that's what it looks like, but this is much more involved. Walk us through it.
Right, so the surgery kind of has two parts. One is removing the cancer, and then the other is rebuilding the tongue, because we don't want to just leave someone with half a tongue, obviously. So removing the cancer, we take out the cancer that we can see, and we ask our pathologist in real time to look at it and tell us, did we get the whole thing out? And in Jason's case, luckily we did that on the first pass, and then we moved on to, like you said, kind of the complicated part, which is how do we put this tongue back together for a man who uses his tongue every day to communicate. And in his case, it happened that the arm, the transplant from the arm, we call it a free flap, was the best way to do that.
Wild to see. I call this like your cell phone charger photo. It reminds me of like a cell phone charger going to it. It's like, when you looked down and saw that, what did you think? You're like, how are they able to do this?
Well, you know, I know that we went through like preliminarily, prior to surgery, I was told where the sites were going to be and you know, where the elected locations would be, you know, to reconstruct my tongue. But when you're going through this, you know, it isn't until after they unwrap everything, because I mean that's quite a big wound that you have to be taken care of, and so after that's a photo of, you know, much later down, you know, probably 2 months down the road through the recovery, but you know, dexterity and things of that nature were not affected. You know, my arm was just a little weak for a few months, and then I was able to get my grip back, but it was, you know, you don't know that though. You're going into this with an unknown of how your body's going to react and recover, and it's on you as the patient to be very active in your recovery process.
So you take the skin, Dr. Cacarala, from the arm, but then that skin has to be replaced. Right. So tell us, you take it from one place to replace it here to put it into the tongue. Tell us where it comes from, and then tell us why this skin right here is best for the tongue. Yeah,
so we make a hole in the arm too, so we don't want to leave someone with the hole there. We take a smaller skin graft, so that's not really a transplant in the sense that we just shave a very thin layer of skin off the thigh, and then we put it on the arm, and like Jason mentioned, his arm was in a cast for a week. The reason we use that skin from the arm is it just has kind of the exact dimensions and depth that we need to rebuild that part of the tongue, and it so happens, not based on just my experience, but many other surgeons over many thousands of patients, that it's turned out to be a really good option.
Were you concerned you weren't going to be able to speak properly?
You know, you don't know what that's going to look like, because you know, the other part of the procedure is that, you know, for them to have access to your tongue, they're bringing your tongue out a little bit, and your tongue has got to generally slide back into place, and you don't know how the healing process of what that's going to be. And so I had very good therapist, speech therapist, to be able to help me through my process, and gave me some exercises, and I did my exercises beyond what I probably needed to, but and at that point I didn't know what I was going to do with the fire department.
Well, you were committed. You said didn't you say in the hospital room, you said, I'm committed to come back and actually be a spokesperson for the fire department.
My dad had asked me, you know, what I was going to do in my career after this, because, you know, generally speaking, with you know, because I had lymph nodes that needed to be removed, and they were tested, and you know, to see if, you know, if I had anything else affected. And you know, when you don't have your lymph nodes in your neck, that's what's fighting your infections, and that's a dangerous thing for us, because we're in these dangerous environments, and not having your lymph nodes as a firefighter, it's kind of a big deal for us, because we're exposed to all these different chemicals, and the lymph system is helping us expunge all those things. And you know, for me, I think I was really grateful the fact that Dr. Cacarala was very encouraging, and so I picked probably the toughest thing to come back on, right? And that was to speak for a living.
Up for the challenge.
Yeah.
So you go through therapy, and then you had to get yourself a good set of tweezers.
I did.
Tell us more about that, because I think that's pretty interesting.
So, you know, you're going through the recovery process, and it wasn't probably until I think, you know, like maybe 2 months, 3 months in, and I had mentioned to Dr. Cacarala, I'm like, yeah, I just felt like I kept having hair in my mouth. And he was laughing, because it's just right on one of your, it's, you know, the hair on your forearm is now in your mouth. And, you know, the option was we could laser it, but the site wasn't as dramatic, and we could just tweeze it out. And so I just, you know, I just start plucking And
it's more grooming, man grooming, manscaping. It's your new area of manscaping. You didn't
just
think
make
you'd
it
have
part
to
of your routine, right?
Exactly.
Yeah.
You're doing a lot of work, though, moving forward. According to the CDC, firefighters are at a higher risk for certain kinds of cancers, making sense with considering all of the toxins and chemicals you're exposed to on a daily basis. So how are you helping prevent this in the future and for other colleagues?
You know, I'm fortunate that I have a really good team that surrounds me at work, and as a collective, we have a great relationship with our International Association of Firefighters, the International Association of Fire Chiefs, and our work groups have been working towards putting washer and dryer extractors for our equipment to be able to remove, cancer-causing agents after the fire. We do what we call a hood exchange, where we go in and when we're wearing the hoods over our heads to protect our faces during the fire, those are then exchanged with new clean hoods after the fire. We wash our gear while we're out of the fire, so we actually have cleaning zones that we now set up so that we take water and we wash off the chemicals from that said fire. And so all these prevention tools, and then using my media background that I developed, we created videos and training materials for we have 1,000 firefighters in our city, and everybody's required to go through those trainings to know how to properly clean their gear.
It's got to feel pretty good to know that you've turned this into a whole new focus.
It's something special to be able to have that opportunity to be able to bounce back. We've done so much, moving forward with preventative opportunities for us are pretty great. You don't really know until, unfortunately, you're reactionary to after the fact, but because of this and this awareness and then education from Dr. Coccarello and his team about what to do for preventative tools for us, that's helped me.
You got the brotherhood, sisterhood of the fire department's got to be wrapping their arms around you. What about family?
Oh, family. It's tough at the beginning of the struggle because you have to figure out how you're going to communicate with people. So their patience with me, because I had to be able to talk, and so I'm texting and I'm writing messages on paper, and you have this nonverbal communication that you're now trying to create, and so the family just wrapped their arms around me and very supportive.
You said it was tougher for them to take the news really than you in the beginning, right?
At the beginning, I mean, yeah, because you just don't know.
You don't. I want to go back and highlight something that you had talked about earlier about the first time you called into the cancer center. So listen in.
I immediately, first thing I did was call the cancer number, and then I had a nurse on the other end, and she was like immediately there for me, like unbelievable. Having a nurse navigator on the other end of that phone who was really just listening to me at first about where my concerns were, and she was doing my mental check-ins, and like she read me quick.
It's when you pick up a phone to call a big, busy place that we have here at the health system, it's hard to imagine you have a connection over the phone, but you certainly did, right?
Yeah, I mean, Rhonda, highly skilled, and you could tell that she'd been in the nursing field for quite some time, and so she was able to read me quickly through my tone of voice, and but she calmed me down.
Yeah. She was a part of kind of your mental, she helped with that mental state.
Absolutely.
You'd never met her before, right?
No.
Okay, well that's about to change. We tracked down Rhonda.
Are you kidding me? Thank you so much.
Oh, you bet. I should meet you.
I mean it. Yeah.
In person.
Yeah.
Rhonda, you're the first person, when I spoke to Jason for the first time, you were the first, thank you, Stu. You're the first person that Jason mentioned, and he said she really just, I don't know, it's hard to, I guess I'll let Jason put it into words and share with you what you meant to him. But it was just interesting to hear someone speak so highly of our nurse navigators.
You became my rock.
Oh.
I mean that, like, you were a focal point for me. See, you make me emotional.
I did
You
on
got
purpose, I love it.
Yeah, unbelievable. Like, you were the you were that calming voice that I needed to hear at the time.
Don't worry about it.
And that was absolutely just like everything was overwhelming, except for I knew I could count on you because you told me I could. and you calmed me down, and then when I was getting all my appointments on my, it was just everything you said you were doing, you did within 48 hours, and it was a calming effect for me.
Oh, good.
Yeah.
What's it like to hear that, Rhonda?
It's an honor. It's an honor and so inspirational.
Well, and I know that for the nurse navigation program, the way that it was originally, because I asked all these questions about, like, how did you guys get formed? Like, how did this happen? And it was through donation originally. And what a big deal that is for us that people saw that they would put money towards a process like this, and that I was directly affected by it. I mean, it was a game changer for me and my family, because I could go in and say, well, Rhonda said.
Rhonda said, this is what we're doing.
This is what we're doing.
This is what we're doing.
And you did that for me.
And Rhonda, you're the gateway. I mean, to someone who has just received some of the worst news they've ever heard. Explain to people exactly what that role is when you have someone calling you on the other end.
Yeah, well, it's just, we want to set their mind at ease. That's our goal. Set your mind at ease and educate you about what to expect, and get you in with the appropriate surgeons, medical, radiation oncologists, and just provide that layer of support and identify any barriers, but our goal is to get you timely access to care.
You did.
Yeah, it's like I was saying before, it's like you're doing the thinking for him. Nobody wants to sit and have to make 100 calls and try to figure out where they're supposed to go, especially when their health is involved. Dr. Cacarala, how important are nurse navigators here at the health system, the Cancer Center?
Yeah, I say to my friends around the country who don't have navigators how lucky we really are, because we can't do our job, and as you're seeing here, that relationship that develops is just, I think, a critical piece of getting people through this.
And you have a gift. Let's keep it going.
Oh, yes. So it just so happens that this program is falling right after 5 years, and so one of the best parts of my job is being able to give people who have survived this a 5-year survivor pin. So
Well,
it says, living with hope.
Thank you so much. I appreciate it, and I'm very grateful for all of you for being a part of my care team and delivering continuous expectations of like moving forward for me. And it's pretty special for somebody like in my situation and for my family, because you guys you're in our daily conversations, and it's just it truly is very special. Thank you.
Thank you so
Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. We are on the X platform, or you can email the Medical News Network. The information is right there on your screen. Let's get over to Dr. Dana Hawkinson with our COVID count this morning. Happy Monday.
Yeah, hi. Happy Monday.
Hi.
Down at Olathe still. So it's
Good to see
down
you.
here.
I know.
Yeah.
They're like, they stole you away from us.
Yeah, I'll be back next week though at where you're at. So
Okay.
good. We're helping people here as well. It's really good. It's good working. It's a good patient population to help, and we have a lot of doctors down here, and of course medical care teams doing that. So it's really good. But moving on to the COVID count, so we are officially out of respiratory viral season. That typically ends about April 1st. What we can say is that we know that influenza and RSV have gone down. We do expect and believe you're still going to have some circulation of SARS-CoV-2 in the community throughout the year, higher levels than, say, influenza or the other cough and cold viruses. But right now at the health system, we have single digits for active infections, 8 active infections of COVID in the hospital, so that overall is a good thing.
Last week, he released a plan to commit $10 billion over the next 10 years to establish a long COVID research program. He says the millions of Americans still living with symptoms should not be forgotten. Sanders has asked patients and doctors and caregivers even to comment on this proposal before it gets officially introduced as a bill. So there's no guarantee that Congress will even approve the $10 billion, but we also know there's still a lot to learn about long COVID, right?
Yeah. Hopefully we will get an approval, or it will be brought to the floor at least. We know that's a separate issue. But what we would say is that we have to understand that this can't be an orphan disease. What does that mean? Long COVID can't be an orphan disease. It can't just be forgotten about. So it impacts so many Americans, but even so many people around the world. It impacts so many people around the world and in our communities every day. There has been some improvements, but we need this research. We need these resources so that we can do the research, asking the very simple questions and the basic questions. What are the mechanisms behind all of these symptoms that people are having? Because long COVID patients have different symptoms. One patient can have different symptoms from the other. So we have to understand the mechanisms, and it's asking the questions. Why are we having these symptoms? What are changes in the body? And then from those questions, we can do the research and try to elucidate those mechanisms and ultimately try to find treatments for it to help these people, number one, get over it and get them back to functioning and feeling like they did prior to long COVID, so that they can be productive and have healthy lives and contribute and take care of their kids, take care of their loved ones, just go out not having those same symptoms that they have been living with, because it does affect so many people every day, going to work, caring for children, whatever that may be. This is one good step to try and do that, to try and ask those basic questions and then try to find those basic mechanisms or even those complex mechanisms, and then ultimately lead to therapies, again, to improve the quality of life. And some of those questions and some of those answers may then bleed over into other conditions or other diagnoses that people may have that may be similar, things like brain fog and chronic fatigue. We may be able to find some answers related to those questions as well. So overall, I think it's very good. I think it is for the general public health of the United States, and we've said this before, when you have healthy communities and healthy residents and citizens, you have overall that rising tide that is lifting all ships. You have a community, you have people who are contributing to society, who have a healthy community, and overall that is the best thing, and that is better for everybody.
Hawk, thanks so much. Let's get to some questions and comments from viewers this morning. Ruth Ellen says, I'm crying. Are you crying? She says she's got some happy tears going on today. And then Judy says she has heard the same nurse navigator story from a friend who is a current patient. What a godsend and a blessing. So just hats off to your team and all of you and all the work that you are doing. Jeremy has a question. Is there anything unique to treating cancer on the tongue versus treating it somewhere else?
Yeah, so interestingly, if the cancer had just been a little bit further back in the throat, we say the tonsil, radiation could have been a better option. So there's something about the tongue that it responds much better to a surgery up front.
Tongue, kind of important. So tell us, are the taste buds any different? What foods taste different?
You know what? I can eat spicier foods now because I have half is gone, right? So,
half the spice, okay.
Yeah.
Any issues eating anything?
No. The therapist did a great job because they worked on fine foods for me. Salads and crackers were going to be my biggest challenge, and she really took the time to explain to me kind of like just where my placements were when I was eating, because at the beginning you don't know, you can't really feel your tongue over where the affected site is, right? Because now it's my forearm over in that area. Mm-hmm. And so all my sensations for the rest of my mouth had to recalibrate and teach me where the placement was going to be when I was eating.
Are you doing a lot of salads at the firehouse? Because when you had me over at the firehouse, we had brats and tater tots.
Yeah.
So are you doing a lot of salads?
Some days.
Okay. You got to clean out the system. Okay, sometimes you do it healthy. Yeah. Last question. Was Jason's the kind of cancer that can be prevented with an HPV vaccine? There's so many different types of head and neck. Explain that for people.
So I just mentioned the tonsil, actually. So oropharynx cancer, the tonsil in the back of the tongue, those are primarily caused by the HPV virus, and we hope in the next 10 to 15 years we're going to see a decrease because people are getting the HPV vaccine. But this tongue, unfortunately, this tongue cancer would not have been prevented.
All right, let's get our takeaways. Rhonda, let's start with you. What's the big takeaway?
Well, we just have an entire Department of Navigation dedicated to good folks like Jason here, and we're here to help guide you through the process and the journey.
Well, I feel very special to be able to have made that call.
Yeah.
Well, just listening to Rhonda's voice, I'm thinking that's kind of the voice I think I might want to hear when I'm going through something really traumatic.
She was extremely calm during my time of panic.
I bet. Dr. Coccarella, what's the big takeaway?
Well, I think you're seeing here kind of the benefit of being treated in a comprehensive cancer center. We have a ton of resources. It's not just a surgeon, it's a whole village of people that contribute to hopefully a good outcome like
And help
this.
get the patient all the way down and getting that pin, that 5-year pin that you just gave. What's the takeaway from your story, Jason?
Community, that it was a community that helped me. And, you know, every day that I go out to go help the members in the community, that same community return that favor. And, you know, we all matter. And I think that's the biggest thing is that, you know, leave it better than we found it. But it's okay to ask for help. That's my biggest thing. And I did.
We're glad you did. Thank you for your service and your continued service and work to keep all of our firefighters safe and healthy. Thank you to all of our guests. Thank you to our viewers for being with us today. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update. Half of all Americans will get nodules on their thyroid. Now there's a way to treat the nodules without an incision. I'm Jessica Lovell on the next Morning Medical Update. Meet a woman who had to educate her own doctor before finding a specialist close to home that could keep her out of the operating room. Tuesday at 8.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.